morning. Good morning, everyone. Welcome. Thank you for being here. Super exciting for me. This is my first Empower, so a special welcome to anyone who's here for their first Empower. Judging from the conversations last night, that is very few of you, because you all seem to be repeat participants. You also raised the bar on me unexpectedly, because everybody spent most of the evening telling me how great Empower has been in the past and setting an expectation for what it will be in the future. Then somewhere in the crowd here, I've now come to know Dr. Dunleavy's here, who is the founder of Empower. Keith, you're somewhere here. Thank you and welcome. I think that's just to add one extra layer of pressure as to what we'll deliver at Empower this week. I know high bars have been set. I heard stories of Cannon Fire and Amelia Island and all kinds of exciting years past of Empower. This year promises to be nothing short of that. We have some incredible guests for you. And the team here at Inovalon has worked so hard to put on an incredible event that I think you'll really appreciate and enjoy over the next 2 days. Let me talk about a few things once I get my clicker going here, because we seem to not be operating. There we go. As I was preparing for today, a couple of things I was thinking about. What's the theme we need to talk about? At the heart of everything we do, of course, is the patient. But I did want to start one step before that with all of the people that make our healthcare system operate. The doctors, the nurses, all of the hospital staff, schedules, administrators, coordinators, health plans, pharmacies. They wake up every day driven with incredible purpose. And they come to work every day hoping to make a difference. We all know, though, that they also face a certain level of frustration. They're often buried in processes, data entry, administrative tasks. We know that these take away from the work that they're doing and the work that they love. They didn't enter healthcare in order to fight with administrative portals, navigate disparate systems, deal with things like prior authorization. Even that, I was thinking about the term. By its definition, you can understand why it causes frustration. You're seeking prior approval to do something that has already been determined to be necessary. So it's no doubt that it's a source of frustration for many in the system. The system is not accelerating the care that we can deliver in many aspects. It's actually frustrating it. It's frustrating it for patients. And frustrated patients ultimately lead to frustrated clinicians. I've seen this firsthand. One of my closest friends for over 30 years, actually everyone in this room I'm sure has a healthcare story where you've experienced how incredible medicine, incredible science, incredible ability of clinicians is marred in some way by very difficult processes and systems. One of my closest friends, over 30 years, he's a cardiothoracic surgeon. 2 years ago, he was diagnosed with throat cancer. Watching him go from the person I've talked to for 3 decades about how the system's changing, the incredible advances in technology, his frustrations with some parts of the system and navigating through it, and then watching him go to the other side of that system and having to figure out for himself how to navigate through it. The countless hours, weeks, months of figuring out how to schedule appointments and get the right treatments, and then dealing with different medical systems where special treatments were required. He knew the science, he knew what he needed to have done in order to save his life, but he was often fighting a machine that wanted to ensure a certain type of an outcome or required a particular approval that would delay the delivery of care. Without his ability to navigate that system, it's not clear to me that the outcome would have been the same for him. And he is incredibly skilled, knowledgeable, plugged into the system. You can imagine what, for your ordinary patient, that journey is like. And that system can become quite overwhelming, contributing to the frustrations and the difficulties that many of us in this room face as we try to improve the system. We need to take that friction out of the system. And that's why we're all here today, to find those tools, the data, the workflow systems, all of those things that allow it to be easier to care for patients, to allow payments to process more quickly, funds to flow, insights to flow, innovation to scale. In this room, you are all the people that are working hard to make that happen every day. You are the teams that are helping millions of people receive that care, making sure their encounters are appropriately documented for quality measurement reporting, for risk adjustment accuracy, while making that clinical moment matter more. You're improving how revenue cycle works at every step and helping patients understand their costs. You're the clinical teams managing complex conditions, therapies, medications, with the care and the precision necessary from a physician's office to a hospital and pharmacy care. And you're using data, massive amounts of complex data to develop new therapies, accelerate trials, introduce new ways of treating disease into the world. That opportunity to play some small part in helping you all do that, that is why I joined Inovalon. Since taking over as the CEO in March of this year, I have been so inspired by the passion and the expertise of the team here at Inovalon. And importantly, I've been so inspired by the passion and expertise of all of you, our customers, the level of commitment, the level of understanding of the depth of the complexity of what you need to do. Together, I'm quite confident that we can take data, technology, and workflow solutions and make our clinical insights better, turn that all into something that helps the healthcare system work better. Our goal is simple: to make that system move more seamlessly, particularly through the flow of data, so that you can work more efficiently, deliver better care, and make a real difference in the healthcare system. We know that right now, healthcare system is under tremendous pressure. Policy changes, cost increases, rising patient expectations, burnout in the system, workforce shortages. It does feel like it's a pivotal moment. We know that a third of physicians expect to leave the field in the next 5 years. That's a tremendous number. Worse, 42% of pharmacists feel the same way. They intend to leave the field, but in that case, in only the next 2 years. 4 out of 10 hospitals are operating at negative operating margins, and of the remainder, 22% operate at margins below 5%. And across industry, about 97% of data that's available goes unused because it is unstructured and not in the systems that are being used. Within the customer types that are here in this room, payers are adapting to regulatory changes, dealing with digital measures for quality reporting, increasing RADV audits. Our provider customers are struggling with some staff burnout, funding uncertainties, workflow challenges. This delays investments in the kinds of tools that could really make a difference. Our pharmacy and specialty care customers, you're juggling all of the complexities of prior authorization, payer requirements, limited distribution drugs, all while trying to keep the patient at the center. And our life science organizations are facing increasing drug development costs, mounting pressure to show real-world outcomes, and an urgent need to use data much more effectively, in particular through the use of artificial intelligence. These are the challenges. You all in the room know them. I'm not telling you something new. And you're all responding. The industry is responding. We do see the industry moving forward. Digital transformation is no longer a concept that people talk about. Every one of you sees it in your workflows. In some cases more so, in some cases less so, but it is happening. AI, artificial intelligence, no longer a buzzword. It's showing up in workflows today, in documentation, in revenue cycle, in prior authorization, in clinical decisions. Organizations want to do more, and they're relying on these tools to allow them to do it better and more efficiently. At Inovalon, we are very focused on where AI specifically can meaningfully reduce the friction in the system. Not replacing clinical judgment, but really enhancing and empowering the ability to make decisions effectively and efficiently. In an AI-powered healthcare environment, what do we think that means? That means the ability to scan thousands of documents in seconds and having those documents flagged where a human review is required. So it narrows the time necessary to find what needs to be found. Predicting claim denials before they happen, giving teams a chance to fix the problem and get paid faster. We see a transformation of prior authorization with AI that actually understands the required data, pre-fills the forms automatically, allows clinicians to review instead of chasing down data in order to submit claims. You'll hear more about these models and all the things we're working at when you hear from some of our partners like AWS, Microsoft, Snowflake, Google, some of the leading technology firms on the planet, all partnering with us to help deliver these types of solutions. Many of you have been at Empower, as I mentioned, for several years. You've watched as Inovalon has grown and evolved. We are now entering a new era at Inovalon, and it is super exciting. It is one that is more even intensely focused on you, our customers, and very focused on accelerating the pace of delivering to you the very best in data and solutions that help take that friction out of the system. You will see some of the product demos and discussions over the next 2 days. I hope you'll have a chance to look at those. The thing that will never change at Inovalon, and has been a constant and will continue to be, is our commitment to improving the quality and economics of outcomes in healthcare. And you'll see that reflected in everything we do. Empower, this conference today, thank you again for all being here. This is all about the conversations that move healthcare forward. It's one of the few places that you can have a health provider sitting at breakfast next to you, a health plan sitting next to you at lunch, a cloud technology leader presenting in the morning, and a pharmacist or data analyst at your table at dinner. This is where data meets real-world experience, where ideas for innovation meet reality, where people across the healthcare ecosystem come together to understand problems, but more importantly, we work together to try to solve them. We are here to support you at Inovalon with the data, the technology, the solutions, the expertise, and most importantly, the partnership to help you reduce that friction in the system, to deliver better care, to create better outcomes for patients ultimately, and for all that work in the system. It's an honor to welcome you here today. I hope you will enjoy the entire program. I hope you have some fun. There should be a little bit of fun mixed in, but hopefully it will be a bit transformative and get you to think about some of the things you're doing differently. You will walk away knowing more, understanding more, and having new ideas from having been here. Thank you all so much for being such an important part of the Inovalon journey. With that, we will get our program started. Thank you.